Good afternoon. This is Kevin Kirkpatrick. I am here with Jody Levac and Julia Mullen from Stevenson Memorial Hospital. Today we are going to talk about working in a smaller hospital, the benefits of what that provides, the challenges that they face, and stuff like that. So if you guys could just introduce yourselves and tell us your role. We'll start with you, Julia.
Hi, I'm Julia Mullen. I am the VP of Clinical Services and Chief Nursing Executive here at Stevenson Memorial. I've been here for 22 months. I come from leadership positions in large academic and community hospitals. Thank you.
Awesome.
Can you guys hear me okay?
Yeah, we can.
Okay. Good afternoon, folks. My name is Jody Levac. I am the president and CEO here at Stevenson. Been in the role over 10 years. Came from I have a wide-ranging background. I've been in big regional hospitals. I was at South Lake Regional Health Center for, I think, 16 years before being seconded here as president and CEO. I am on my own board contract, so I've ended the secondment and have been working with the Stevenson Medical Advisory Group heavily on recruiting physicians and bringing folks to our unique community. You know that there's no snow in Alliston. It's a wonderful community. We are about 45-minute drive out of the downtown of Toronto, probably more like an hour now with traffic. So we're kind of a cusp community outside of the GTA. It would be characterized as a farming community. But if you ever drove here, the banner when you come into town of Alliston says "Rurban." It's not urban. It's not rural. They kind of combine the words, call it Rurban. So we've got a lot of growth happening in the community. It's kind of a little country town of, say, 15 years ago to a big box stores and looking to have over 100,000 residents by the year 2028.
Wow, that's a massive amount of growth. How big is the hospital?
We are a 38-bed inpatient facility with a combination of in those inpatient beds of medicine, surgery. We combine them in small shops called med-surg beds. We have obstetrical beds, and we have level 2 ICU beds. And we've worked a hybrid model of level 2 ICU. Happy to talk and share a little bit more about that. We have a plethora of outpatient clinics. Many of our specialists, there wasn't enough volume here to run a full-time practice here in Alliston. So we have people we have psychiatrists come here. We have nephrologists from RVH. We have cardiologists who do echoes, etc. in our outpatient programs. We have a fairly robust outpatient go. And on our surgical side, we're mostly general surgery. We have a bit of specialty. We have some ophthalmology here. We do cataracts, and we do have a unique surgical line here for dental. So a couple of our dentists, and we get referrals from all over Ontario, high special needs children who can't go under regular anesthetic at the dentist's office come here. So we allow a couple of our dentists to have a go in the OR. We also have a very busting midwife program that works with obstetrics. So I don't know, Kevin, does that kind of give you a sense?
That's a great start, and that leads well into the fact that we are currently recruiting an OB-GYN for Stevenson. Let's talk about that a bit, right? You mean, what did you mention to me? I think at the onset is they do about 600 births a year.
Okay. Yeah, I'll start. We had 4 of them, and we had a retirement, so we got 3. So we're facing some redirect challenges because the crew's working real hard, and we're trying to recruit that 4th OB to close the process. Kind of unique here in terms of obstetrics. We do offer clinic. Small hospitals, you'll find, try to do these unique recruitments where we cover your overhead space or at least a space to do an outpatient clinic. And limited clerical support. They pay a pool to try to help. The OBs are a little stressed because there was 4 of them splitting a little bit of secretarial help, and now there's 3 of them splitting that cost when we lose one. I think Julia can talk a little bit more about the the dynamics there in our clinic and our model of care?
It's certainly busy, Jody. So having come from 2 other community hospitals, Midland has about 150 to 200 births a year. Perry Sound has about 110 to 120. So we see anywhere between 550, 600. So it's very busy, but having the obstetrical clinic as well. We do a lot of assessments. There's lots of opportunity for growing your practice and learning skills. And the OB team is, as Jody had referred to, we have 9 midwives, which is one of the larger midwife programs, and they're lovely. They've worked with us. Marcy's worked with us for over 16 years and really leads a good group of midwives.
Nice. Excellent. If you had to say why someone would join the OB group, what would you say is the prevailing reason that someone would come and join the group?
I'll start off, Jody, if I may. Is that it's, we're small, so we're like family. The collaborative team approach is really wonderful. The skills complement each other in terms of midwives helping newer OB-GYN docs, upskill. We have RTs 12 hours a day. So most community hospitals have a Monday to Friday, 8 to 4. We've got 7 days a week, 8 to 8.
Oh, nice.
And there's some really great RTs. They teach NRP, neonatal resuscitatory program. So, you've got experts on site to run some mocks, skills and drills. So it's a really good team, and we have some great collaboration with RVH and South Lake and Sick Kids for those sicker babies or higher risk births.
Awesome. Anything to add, Jody, before I move on?
I think Julia touched on it. We're a level 1, Julia. I always get the designate 1B.
You got it.
High risk births we don't have here, and the 3 obstetricians that are here are they're loyal, they're dedicated, they're younger. I got to watch myself here. They're one's a mid-age doc. So what I'm saying is we got good breadth of experience here with colleagues. You're not alone. And a real collegial environment with the 3 of them. They're a good group. They cover for one another. There's a sense of, togetherness in the group. So if you're an obstetrician looking and you don't want to be in a big academic teaching hospital with all those demands, this kind of gives you a more relaxed, certainly birthing babies is not relaxed, but there's a relaxed atmosphere in which you work in.
Right. Awesome. Now, one of the other roles that I'm helping you guys with that we've been working with some locums and stuff like that is the hospitalist program, right? So I know hospitalist work is relatively attractive to most. Can you talk a bit about that program?
Do you want to
Sure,
go
you want
first?
me to kick that off, Jody?
Sure, go for it.
So we have 32 beds within our med-surg inpatient unit, and we have a hospitalist program, which means they're dedicated to our inpatients. Dr. Gaurav Dinsa is our chief hospitalist right now. He's lovely. I think he's been here at least 6 years. Jody, even, yep. So he knows the team very well, works closely with our Emerge folks. And just recently, some of the feedback we've been having is that the complexity of our patients is getting higher. So we've worked with Dr. Dinsa to bring in a nurse practitioner model to help with our hospitalists. So they're looking after alternate level of care patients, the ones that are very stable, not ready to go home, but needing to find the appropriate place, be it a retirement home, a rehabilitation, complex care. So we've just started that model so that they can take care of those patients, the nurse practitioners, leaving some time for our hospitalists to really focus on those medical and more complex patients.
Nice.
Yeah. And Jody, I'll let you, and we do have, again, we have a manager of that unit. So her sole focus is that unit, to assist with any issues or to help. She works closely with the chief to look at what strategies and projects and initiatives they're working on. So it is, again, a really nice, small, collaborative group.
Nice. Excellent. Yeah, and I've been communicating with Dr. Dinsa for a few months now, and he's super responsive. Everybody that he's talked to has been quite interested in, at least almost everybody he's talked to has done at least on a locum. It's just, now we gotta find the person that wants to land and stay permanently, right? So
Yeah, if I could talk about the elephant in the room for docs, which is revenue, which
Right.
nobody ever wants to talk about from a healthcare perspective. But, we try to be very competitive. So the hospitalist model does have a basis of fee for service. So you do your
Right.
fee for service work, but we do have a daily stipend to try to top up and make us competitive, make hospitalist work important. And so for docs who are running primary care practices or doing different lines of service, if you will, the hospitalist is kind of a steady gig. We've done a lot of work on trying to create a later call system for the docs, the nocturnist on call, if you will, so that when you do your day here, there's some relief. And the revenue is competitive. I mean, the senior team invested back into a stipend. There's a vision down the road that most hospitals of our size across the province of Ontario are going to go to what's called an APP plan, alternative payment plan. And that will be standardized no matter where you go in the province. So if that unfolds here on the vision of the next 3 to 4 years, you want to be here because we offer the joys of living close to the city with a bit of the country spirit that so many people enjoy.
Nice, yeah, and it's what I found too is it's a pretty collaborative group that's approachable. The longest I think it's ever taken anybody to get back to me has been about 36 hours, which for physicians is a phenomenal thing from that standpoint, right? So it's it's quite an interesting area and stuff like that, right? So awesome. Well, listen, I just wanted to introduce you guys. Now, the one thing I'll ask is this is going to go out to my net. This is going out to my network, and there's all kinds of different physicians and stuff like that. Now, you've engaged my firm on a few, but are there other vacancies and stuff needs that you have that you'd like to share with my network in case anybody's listening that might be interested in Stevenson?
Yeah, Julia, can I answer that one or what?
Yeah, yes, please do.
Yeah, so there's always opportunity. The hospitalists and OBGY are big needs at this point. We have a fairly talented group of emerged physicians that have created a real consistency. There's always opportunity to sort of come on board and help get a sense of the building by working in emerge. Dr. Matt Myatt is our chief, and he's been phenomenal at onboarding and allowing people to have an experience that way. The outpatient clinics we have, it's varied in terms of the specialties. I'd have to be able to really sit down with folks and go over that. We really don't. We're not looking to expand some of our outpatient clinics at this point. We've got enough. But if you were sitting here and you're a psychiatrist or you're a cardiologist, if you're a nephrologist, it still doesn't hurt to reach out and see what opportunities we might be able to look and work together on.
Right. Excellent. All right. Well, I appreciate both of your time today, and thank you for letting me introduce you to my network. And hopefully we'll start some conversations and get the word out.
Yeah, so I'll leave you with this. So we have a dedicated Alliston Ontario physician recruitment group. That's a unique group that the hospital has been leading in that space. It's the municipalities all coming together, and we look at different unique ways to onboard physicians if you're interested in coming to this community. So it's like my lifeline to call if somebody's interested around some expenses, some of the nicer amenities, even getting to know the community. They do a little tour. I had to laugh. I'll leave you with this, Kevin. I saw the list that the Alliston and Area Physician Group used to do 45 years ago when docs came to our community. Free meals from the church, and goes all, real small town community feel. We've sophisticated that list over time, but you'd really want to, if you want to hear more about what we can do to support your understanding of the Alliston community, you just have to reach out.
Sounds good. And I know for a fact you're both on LinkedIn, so if anybody wants to reach out, they can reach out to you there, or reach out to me and I'll be happy to make some introductions. So have a fabulous week, and I will talk to you both, I'm sure, at some point soon.
Super. Thanks, Kevin.
Thanks again for the opportunity, Kevin. You have a great day.
All right. Take care, guys.
Bye.